Hello everyone, my name is Marianne Trapoto, and I'm going to be doing a presentation on leadership in healthcare management. We are going to be discussing a current issue within the healthcare organization that needs to be brought to our attention. Within that, I have a leadership model that I developed based on different leadership models that I put together that you will see here within this presentation. I will go into detail and discuss that leadership model and see how it will directly impact the organization. We will start with the first slide with the current issue. The current issue within the healthcare organization is the nursing staff shortage. This shortage is directly affecting everyone within the organization. It affects the nurses, it affects all staff, including management and doctors. Everybody within the whole organization is affected by this shortage. With this shortage, you have a quality of care is being compromised. Now, within my leadership model that I'm going to be discussing, you will see how this issue is correlated with my new leadership model and how this will help with this issue. And here we have my leadership model that I've developed. The leadership model is called the Dynamic Patient-Focused Leadership Model. This model that I've created is patient-focused. I feel that when you are leading in a healthcare organization, you need to think about your patients who are a stakeholder. You want to directly focus on that within your team. So the first part of this model, there's 4 parts to be explained here. We have strategic planning and critical thinking. Strategic planning is a big part within the issue that we have talked about previously. You want to plan for the future. And critically thinking comes with making decisions, problem solving, all of that. Then we have effective teamwork. Effective teamwork is a huge part of leading. You want to make sure everybody's on the same page and helping each other throughout. Next, we have quality care. Leading with quality care as a main focus is a big part, especially for our patients, since we know that they want quality when they are getting healthcare services. And lastly, we have strong communication. Strong communication might be the most important thing. Without communication, there is no quality, there is no teamwork, and there is no critical thinking and making decisions. You need to have strong communication to do any of these. So all of these kind of work in together within this model. And now we'll talk about how adapting this model within the organization. How would we adopt the model within the healthcare organization? First, we would explain how the model works. Making sure everyone understands and getting feedback from everyone is a big part of this. Addressing concerns and maybe getting feedback, positive, negative, and working together to see where everybody fits within this. Key stakeholders within this model would be the caregivers, clinicians, managers, and patients being the ones who are going to be receiving this and getting better quality and patient focused within the model. Making sure the caregivers, clinicians, and managers are all on board with this model and making sure they're all aware of the changes and aware of how the model works. Next, we have efficiency and effectiveness. We want to make sure that this leadership model is efficient and effective. How would we do that? When utilizing this model, the biggest thing is patient satisfaction. You want to make sure the patients are satisfied. That means this leadership model is working. And how we would do that is compare inputs and outputs. this could mean the number of patients being seen compared to the patients satisfied. If we're having a high number of patients that we're seeing each day, but our patients are not satisfied, we are not being effective. But if we have the number of patients being good, amount being good for the day, and then a patient satisfying being great, then you can see we are being effective, that this model is working. Productivity efficiency would mean we are looking at the work expended to produce healthcare products. So is the work expended meeting the healthcare products? So that's how we measure productivity efficiency. Are we being productive? Response efficiency would refer to how quickly we're responding to requests. And that comes with the strong communication and effective teamwork. And that would mean how we are being efficient. So that is how I would measure how this leadership model is being efficient or effective. This specific model will impact processes, motivation, interpersonal relationships, and communication. This model will affect processes because you're going to have effective teamwork, strong communication, quality of care, and you're going to be thinking strategically and critically. Now, your processes are going to be more streamlined because of this. Your motivation is going to increase because you're going to have effective teamwork and you're going to have strong communication. When you have those things, motivation increases. Your interpersonal relationships and communication are going to also increase because you're going to have that effective teamwork. You're going to have strong communication based within everybody on the unit. Now, your quality will rise within all of that as well because you're going to have that strong communication. Quality of care is a main focus within this model. Then we have performance. So the performance of processes, your interpersonal relationship and communication, that's going to go into with efficient and effective. If we're being efficient and effective within this model, our performance is going to be good, is going to be measured good. And next, we have finances. So our finances are going to positively correlate with this model. So if we're having quality care focused, we're having strong communication, we're going to have less errors. So that means that our finances are going to decrease. And then lastly, we have change management. So with this new model, we are going to be making changes, and how we do make these changes makes a difference. Making sure everybody's on the same page and implementing this is huge. So working on our processes and motivating people to make the change is also a big part of this model, and it impacts that. Lastly, here we have the conclusion. So in conclusion, you can see change is good. Within this, utilizing this model, correlating to the issue of a nursing staff shortage, we're going to strategically plan and critically think within this issue. What are we going to do for the future? How are we going to move forward? We're going to critically think and make decisions based on that. We're also going to have effective teamwork. We're going to lead in a way that effective teamwork is important. And we're going to make sure everybody's on the same page, working together, helping each other out. That is big. Quality of care. Quality of care is a main focus of this leadership model. We want to make sure that that is a focus and we're making sure our patients are satisfied. And lastly, strong communication. Strong communication is probably the lastly and most important part of the model. Having strong communication within the organization is going to help our issue of a nursing staff shortage. We're all going to communicate with each other, working together to help fight this. And reevaluating the current leadership model that we have, making changes and implementing this model can positively impact our organization and could greatly affect us in a positive way. And I hope to see this model being utilized. And lastly, here we have the references. This is the references that I use to develop the leadership model. Feel free to go to the book and look through the other leadership models that are there and how I utilized and brought together mine. Thank you everyone for your time.